Another sign is a sudden gush of clear odorless fluid, or a constant trickling that accompanies those contractions. If the fluid is a little yellowish or has a little tart odor to it, it may be urine. But if you notice that it is constantly leaking, you want to write down what time you started noticing it so that you can share this information with your doctor. Hello and welcome back to Nurse Onyi Teaches. My name is Onyi. When a woman becomes pregnant, especially if it is her first pregnancy, it is really difficult to keep her from thinking about what labor and delivery may bring with it. Now, it is very important for a woman to know that there is a difference between false labor and true labor. So in today's video, we'll be covering things like contraction patterns, vaginal discharge activity, GI response, and when to call your doctor so that you can be more confident as you near your delivery date about what constitutes real labor and what is false labor. Now, if this is something of interest to you or you would like to learn more about the maternity subject, make sure you hit the subscribe button and don't fail to turn on your notification bell, because that is how you are made aware of every time a new video is uploaded. Without further ado, let's get going. So the first thing we'll talk about is what constitutes false labor so that it can be adequately compared to what is true labor. When a woman becomes pregnant and starts going into her second trimester, she can start experiencing signs of false labor that include contractions known as Braxton Hicks contractions that may come more frequently and be stronger as the pregnancy advances along. The problem with Braxton Hicks contractions is that they don't last long, usually between 15 and 30 seconds, although they have been known to push their way into the 2-minute mark. But the distinguishing characteristic with Braxton Hicks contraction is that they are irregular. They do not become closer together, where labor contraction, as will be shown later on, do get closer together. And Braxton Hicks contractions can actually become weaker, eventually stopping or going away. Now, in contrast to false labor, true labor typically begins as a woman nears the end of her third trimester, closer to her due date. These contractions that she begins to experience will be stronger, they will last longer, and they will come closer together. It is very important for this trio of activities to occur so that the cervix can become thin and begin to dilate in preparation for birth. Another thing that moms will notice is that their contractions will establish a regular pattern. So maybe initially you will notice a contraction coming every 10 minutes, and then as your labor becomes more intense, you will start noticing that those contractions get closer and closer together. Eventually, they may even start coming a minute apart as you near the birth of the baby. It is very important for you to keep a watch or something that you can time these contractions with so that you can tell the difference between true and false labor contractions. Another thing that can clue a mom into whether she is dealing with false labor or true labor is the type and quantity of vaginal discharge that she is experiencing. So you want to pay attention to what is going on down there. If you are in false labor, you will not have your baby's amniotic sac or membranes rupture. You may experience increased discharge because those contractions will squeeze down on the contents of the pelvis, causing your body to slough off a lot more discharge. But that discharge tends to be normal in color and texture. Now, you may lose your mucus plug, but rest assured that losing the mucus plug does not mean that labor is imminent. The body has the ability to regenerate or construct a new mucus plug so that pregnancy can continue successfully. But you definitely want to let your doctor know if you think you've lost your mucus plug, just so that they can keep an eye on things for you. Now, in contrast to the discharge that accompanies false labor, note that when a woman goes into true labor, her vaginal discharge will be increased, but there is a chance that it will be stained with blood. Now, if you lose your mucus plug here, note that the loss of mucus plug can accompany both false and true labor. Now, as your cervix begins to stretch in response to those contractions that are coming together stronger and lasting longer, it will cause the blood vessels that are around the cervix to begin to break and leak into the mucus, causing it to appear bloody. Another sign is a sudden gush of clear odorless fluid, or a constant trickling that accompanies those contractions. If the fluid is a little yellowish or has a little tart odor to it, it may be urine. But if you notice that it is constantly leaking, you want to write down what time you started noticing it so that you can share this information with your doctor. If changes in your level of activity causes any changes in your contraction patterns, there is a chance that you may be experiencing false labor. For instance, say you start to experience a lot of contractions and you lay down to rest, or you get up and grab a cup of water and drink it, or maybe you even go for a walk and you notice that those contractions start to go away or they stop altogether, and there's a chance that that was not real contractions to begin with. When you are dealing with real contractions, no amount of rest, hydration, or positional change will stop these contractions. In fact, if you plan to go walking, there's a chance that that walking can further irritate things in your cervical area and your pelvis and intensify your true labor, because with movement and gravity working together, your baby can become more engaged in the cervix in preparation for birth. Another difference between false and true labor is how your body is responding to it. Your GI tract constitutes everywhere from your mouth all the way through your stomach, your intestines, and out the anal canal. Now, during false labor, there is no change in how your body is responding. You can go on and eat, and you can have normal bowel movements as you have regularly had throughout your pregnancy. If it is true labor and as it becomes more intense, there is a chance that you will deal with nausea and vomiting. This is because as labor becomes more intense and tasking on your body will send more blood and energy to your uterus so that it can function properly. This, however, takes away blood from your GI tract, causing things to slow down and stop moving altogether. Well, food does not like to sit around in the stomach, nor does poop like to sit around in your bowels. So it can lead to diarrhea, and it can also lead to nausea and vomiting in a woman who is in true labor. Now, whether you are experiencing true or false labor, there are some general things that you need to keep in mind so that you can let your doctor know or head to the hospital if you experience any of them. The first one is if you notice any bright red bleeding, you want to get seen as soon as possible. Bright red bleeding is not normal during pregnancy. If your contractions are occurring every 5 minutes and lasting between 30 and 70 seconds, you may be going into the active phase of labor. And if your body is not ready yet, you want to get seen. If your body is ready, you still want to get seen so that you can start to monitor those contraction patterns. Another thing is if you are no longer able to do your normal activities or walk during these contractions, you definitely want to call your healthcare provider or your OBGYN so that they can evaluate you for true labor. If you experience any increase in your pelvic area, know that there's a chance your baby has become engaged and is preparing to be born. So you want to go get seen as soon as possible, or contact your healthcare provider and further describe the symptoms that you're experiencing, especially if you're having contractions with that pressure that you are feeling. Now, if you have learned anything from the content of this video, make sure you give it a like. Do not fail to hit the subscribe button and turn on your notification bell, because how else are you going to know when new videos are uploaded if you don't hit that notification bell? Also, if you know somebody who can benefit from this content, do not fail to share it with them. Make sure you join this growing community of empowered learners who are active participants in their own healthcare. I wish you a happy pregnancy and a safe delivery, and until the next time, be blessed.